I was saying I'm so sorry to interrupt dessert, and please continue. I first wanted to thank Iram for his very, very kind and generous comments, and I know whom to go to for my eulogy. But not too soon. I'm Marie-Josée Kravis, and I'm very happy to welcome so many familiar faces here today, and also welcome a lot of new attendees. And for those of you who've attended many of those dinners, I hope you'll bear with me as I say a few words about the Kravis Leadership Institute and the prize. And I should say, first and foremost about the Institute, that it was not my idea at all. It's the idea of my husband, Henry. And I think he had in mind when he created the Institute a very strong desire to expose not only faculty but also students to new ideas and to people who had taken risks, who had challenged conventional wisdom, who had invested themselves in pursuing dreams and new ways of thinking and doing, and who had really created a result that wouldn't have happened had they not done what they endeavored to do. And in doing so, improve the world, or at least the worlds in which they lived. And from that idea of the Institute and the success of the Institute and the very active participation of students and faculty came the idea of the prize, and the prize to reward people who had been leaders in the world of philanthropy. And I use the word leaders in a very broad way, but I think it's a business person who once said that before you're a leader, success is all about growing yourself. But when you become a leader, success is all about growing others. And the people that we honored in the past, and Iram pointed out the number of participants or recipients who have come back to continue to share their experience with us today. The people we've honored in the past and the recipient this evening, whom I'll introduce in a few minutes, are all people who have done exactly that. They've been leaders in terms of sharing their success by growing others. And they reach now, we've calculated, roughly 560 million people in 75 countries. And it's been wonderful over the years to watch all of them grow, broaden, and deepen their work. And I know that you met here yesterday and you shared so many of your experiences, and you face so many challenges that the for-profit world faces. Focus on mission, avoiding mission creep, strengthening your boards, your capacity for fundraising, preparing succession, ensuring good governance. And it's wonderful to see you all exchanging your own experiences and learning from one another, and also teaching us how we can help you and how we can improve our interactions with you. And I have to highlight the work that Kim Yonker does, not only in helping us with the selection process, working with the anonymous nominators, doing the due diligence, and advising the selection committee, Kim, but also in keeping our recipients in touch and also sharing amongst them the lessons that you learn from each of them. So Kim, I really want to applaud what you do. Now, I mentioned due diligence, and that takes a great deal of Kim and her team's work, and that is maybe one of the distinguishing features also of the prize, is that we try to focus on impact and not only on input. So not only what a program costs, but really what a program delivers. And I like to give the analogy of a movie. You wouldn't judge the quality of the movie by its budget, would you? Well, in the same way, you wouldn't just judge a program because they're spending so much per child, or they're spending so much per program, or so much per activity. You really want to focus on outcomes, and outcomes have really become the organizing framework for many aspects of our lives. Now we look at healthcare, and it's not the number of medical interventions, but we're looking at measuring the quality of healthcare by outcomes. The same with education. It's not the number of students who are enrolled, but you're looking at graduation rates, students going from high school to college and staying in college and graduating, and then the transition from school to work. And all of these elements, which are really measuring impact and not strictly inputs, are very much the framework, not only of public policy, but certainly of this prize. And it's interesting that this evening we are honoring an organization that runs one of its programs that's been described by the World Bank as the single most cost-effective health intervention in the world, and that is the delivery of vitamin A, which costs less than $1 per year per child. Mm-hmm. But that less than $1 per year per child can not only prevent blindness, but boost a child's immune system so that that child is resilient to a wide array of diseases. And the Helen Keller International Group, which is our recipient, is the leading distributor of vitamin A around the world. So I'm happy to introduce the Helen Keller International as the recipient of the Kravis Prize for 2014. It's an institution that is established, in fact, will celebrate its 100th year anniversary next year. So this is just the prelude, I hope, to a very exciting celebration. But an organization that works in 22 countries, that works with over 200 million people, and that works largely in countries where I think blindness is 3 times as high as it is in the developed world, and where 2/3 of the people who are blind are women and children. So just think about that for a minute. Just think of not being able to recognize your children. Just think of not being able to recognize your parents. Just think of a child not being able to go to school, because there are no special schools in those countries. Not able to read, not having a future, in other words. And the studies undertaken by HKI show that 80% of those cases of blindness could have been prevented. So in other words, 8 out of 10 people who suffer from blindness could, with science and less than $1 per day, $1 per year per child, could have had the gift of sight, the gift of learning, just the gift of vision. And that is only one of the programs that HKI undertakes. They also work with very rare diseases relating to blindness, trachoma, or river blindness. They work also with older people who have cataracts, and they restore blindness. And they also work, for example, in the United States, in underprivileged communities where 20% of children need glasses. And they've pointed out that oftentimes these children are diagnosed or sent to special ed classes not because they should be in special ed classes, but just because they can't see the blackboard. They can't read. And so these are transformative interventions in the lives of children and in the lives of their families. But even that's not enough. They work also to combat malnutrition. It's very important. The first 1,000 days of a child's life, the first 2.5 years are very important in terms of the child's development, formation of the brain, formation of synapses. And they work very closely with mothers and babies to ensure proper nutrition. They work with families to establish growing better seeds, improving yields, improving the quality of produce, improving the quality of nutrition. They provide food for fortification, cooking oils, for example. So all of these interventions to ensure that people see and are well fed. And I can't think of an organization more deserving of the Kravis Prize and more faithful to the words of its founder. I guess it was two founders, George Kessler and Helen Keller. But I'll quote Helen Keller in closing and inviting Kathy Span to come and receive the prize. Helen Keller, who said that the welfare of each is bound in the welfare of all. And you are continuing that tradition in an inspiring and exemplary way. And we applaud what we do, and I invite you to come and receive the prize.
Thank you so very much, and I have to say that Marie-José's comments just now give us just one shadow of a sense of the due diligence that Kim Yonkers and her team do to research the organizations that get the prize, because your comments were spot on. This recognition is incredibly meaningful to us. As Henry Kravis said to me during dinner tonight, wow, HKI doesn't get a lot of these prizes and awards. So for us, this has huge meaning. We're incredibly honored to be acknowledged for our efforts. So I thank Henry and Marie-José for creating this award and for choosing us this year. I thank Claremont McKenna College for hosting such a wonderful event. I thank the selection committee. And I have to say, what I didn't know coming into this is that there's a Kravis Prize family. And once the announcement went out about us getting this award, all of the previous prize winners wrote to me, welcome to this family. We're so excited. We're looking forward to meeting you. It's an incredible sense of community. We've been meeting over the last 2 days. And it's about this incredibly generous prize, but it's about so much more because we're all working together and learning from each other. It's just a phenomenal thing to be part of such a community. I accept this award on behalf of everyone at Helen Keller International, our board, our staff, our partners around the world, but mostly the many millions of women and children that we work for every single day. Our inspiration comes from our founding trustee, Helen Keller, who I imagine you've all heard of. She was a woman of tremendous courage, determination, and spirit. And it's that spirit and heart that guide us still today. Even though she passed on in 1968, she's still with us, inspiring us each and every day. And true to her values, we're committed to helping to create opportunity and hope for people living in the world's poorest countries and in the world's poorest communities. We have a very simple premise, which is to provide our fellow human beings with things that are basic and that we often take for granted: our sight and our health, and our ability to get the care we need when these are threatened. So we are dedicated to saving the sight and lives of the world's most vulnerable and disadvantaged people, and we have a particular focus on women and children. And we do this through programs that are based on solid scientific evidence that are continually tested, evaluated, refined, reevaluated, so we can always improve our results. Nearly 40 million people around the world are blind, and being blind in a developing country is very different than being blind in the Western world. Here, if you get cataract, chances are you go to your eye doctor, you have simple cataract surgery, and your sight is restored. Quick operation. If you are unfortunate enough to go blind, chances are there are support services available for you in your community. It's not the case in developing countries. As Marie-Josée said, blindness means a complete loss of opportunity. Blind adults aren't able to work, so their families are trapped in a cycle of poverty and poor health. As Marie-Josée said, in most of the countries where we work, 2/3 of everyone who's blind are women and children. So you have women, mothers, who are no longer able to care for their families. And you have children who now are not allowed to go to school. They can't learn. They can't become productive members of society, which is all of you who are parents now of Claremont McKenna students hope for in your children. As Marie-Josée said, 8 out of 10 people around the world that are blind didn't have to go blind. There are proven solutions to prevent or treat their blindness, whether it's surgery, whether it's medication, whether it's simple basic hygiene, washing your hands and your face to stop transmission of diseases that make people go blind. So that's what we do at HKI. We take these solutions, and through training and education in country, we help countries around the world adapt the solutions to their local context and then bring them to scale. The largest cause of preventable blindness in children around the world to this day is still deficiency in vitamin A. Here in America, I think we all take vitamin A for granted. It's a natural part of our diets. It's in dark leafy greens, it's in spinach, it's in the newly very popular kale, it's in carrots, and if you're of my generation, you grew up with your mother saying, eat your carrots so you can see in the dark. Well, that's actually true. It's not a mother's myth. It's in fish, it's in eggs. But this isn't the case in developing countries where the diet may consist mainly of rice and of other non-nutritious foods. So for decades, we've been a leader in programs that ensure that high-dosage vitamin A supplements reach children under 5 twice a year. This is proven to prevent what is now called nutritional blindness. We work behind the scenes, though. So we work through governments, we work through local health centers, and right now we're reaching more than 50 million children a year in sub-Saharan Africa with this sight-saving intervention. But as you've also heard from Marie-Josée, vitamin A power goes far beyond saving sight. In the 1970s, we participated in groundbreaking research through our programs in Bangladesh and in Indonesia that showed that if you can control vitamin A deficiency, you can decrease the risk of a child dying by 25%. That's because vitamin A is necessary for all of us, for our immune systems to function. And if a child doesn't have sufficient vitamin A, his or her immune system is not going to be strong enough so that when they get measles, when they get diarrhea, when they get a respiratory infection, they're going to die. These are diseases that should not be fatal anywhere. So this little capsule, and Henry has one in his pocket right now, twice a year at a total all-in cost. That includes getting the capsules from where they're manufactured to Africa or to Asia. It includes training the health workers. The actual cost of what I'm holding is 3 or 4 cents. The all-in everything, including operational overhead, is the $1 a year per child cost, which now you can see why the World Bank calls it the most cost-effective public health intervention. For us, the knowledge of the power that was in that one little vitamin was a lens onto the larger challenge of malnutrition. 2 billion people, that's nearly 1/3 of the world's population, suffer from malnutrition. And perhaps more shockingly, recent studies were done that say malnutrition is responsible for nearly half of all deaths of children under 5 in the world. Malnutrition, you've got 45% of children under 5 dying because they're malnourished. Knowing this, we built on our already successful vitamin A programs to develop other cost-effective, locally adapted, and sustainable solutions. And I say locally adapted a lot because it has to be tailored to local circumstances. Chief among these programs is what we call homestead food production, which empowers women to plant gardens where they can grow nutritious fruits and vegetables year-round and raise chickens and, more recently, even fish. We provide the mothers with seeds, seedlings, saplings, chickens, fish, poultry vaccines, and the training and tools so that they can produce those fresh, nutritious foods right in their own backyards. But we adapt the program and the crops to each location we work in because it's critical that the mothers are comfortable with the food, what it looks like, what its texture is, what its color is, what it tastes like. It's critical their children will eat the food and that the local climate can support the growth. You all know the Chinese proverb, give a man a fish, he'll eat for a day. Teach a man, or in our case, a woman, to fish, and they'll eat for a lifetime. And that's what we do. We not only teach them how to plant and grow these foods, we teach them how to store them, how to process them, how to cook them. We do recipes, everything, so it's an all-in package with an added bonus that they now are growing enough that they take surplus produce to market. So these women are becoming economically empowered. They're able to contribute actively to the financial stability of their families. What do they do with the money? They buy other nutritious food. They pay for health services for their kids. But 9 times out of 10, they use the money for education for their children so that their children can come out of poverty. And we measure the impact of all of this work. We go back in and we interview the mothers. What did you eat over the last 3 days? What did your children eat over the last 3 days? What did you buy with the money you earned? But we're very science-based. We don't stop there. We go back in and we do finger prick blood tests to measure the nutrient levels in their blood. We measure their children's height. We measure their weight and their growth to make sure these programs are doing what they were intended to do. And I have the extreme privilege of seeing the impact with my own eyes in families like Margaret's, a little girl I met in Tanzania last year. We met her when she was getting her vitamin A supplement at a Child Health Day, which we created in partnership with the Tanzanian government. The Child Health Days are an amazing platform because it's not only for children and their moms to receive vitamin A supplementation, but you use the same platform. They can get antibiotics they need, they can get medications they need, they get education on nutrition and good health. But none of that mattered to Margaret, little Margaret in her pink dress. She was so proud because she wanted to make sure that as the visiting dignitary, I knew that she helped water the plants in her mommy's garden. To date, these programs have reached more than 1 million households throughout Africa and Asia, and they are growing. What we've seen is a significant decrease in blindness among children in these households. We've seen a decrease in anemia among many of the mothers. We've seen a huge increase in consumption of nutritious foods. But perhaps most exciting, we see the participating women becoming leaders in their villages. Widows who are no longer dependent on the kindness of families and neighbors to survive, and girls who now have examples of strong women that are going to inspire them so they can take over gardens and markets and learn a lot from their mothers and their grandmothers. We also seek out those at risk of being left behind right here in the United States. Our program called ChildSight provides free vision screenings and prescription eyeglasses to students living in poverty in the U.S., from East LA to Navajo reservations to the South Bronx in my hometown. 1 out of 4 children in the United States have some kind of refractive error, meaning they're either nearsighted, farsighted, or have astigmatism. So we target high-need communities. As those of you know who wear glasses, and I don't see too many pairs tonight, but I imagine there are some reading glasses somewhere, the cost of a pair of glasses these days is prohibitive. Families living in poverty are faced with a difficult choice of, do I pay rent, which in the South Bronx is less than the cost of a pair of glasses? Do I buy groceries? Or do I buy my child the glasses he or she needs to see the blackboard? In these communities, often 20 to 30% of the children we screen need glasses. Last fall, we screened kids in a school in the South Bronx. 43% of those kids needed glasses. And as Marie-Josée said, some of them are ending up in special ed and they're thought to be slow learners, and it's not the case. So we go in the schools, we screen them right there. We have an assortment of about 40 pair of very trendy glasses. Whatever is hip is what we provide, because if you're 11, 12, 13, you're not going to wear glasses unless you like what they look like. There was a student named Joanna, 7th grade student in the Montebello School District, which is just about an hour from here if I've got my geography right, which I might not. She struggled with poor vision for many years, and her mother was struggling financially, so even though she knew her child had vision problems, she couldn't afford glasses. Joanna also had attention deficit disorder. Vision problems, ADHD, wreaked havoc with Joanna in school. 12 years old, her grades plummeted, her behavior was off the charts. She acted out in class, increasingly frustrated because she couldn't see the board. So ChildSight visited her school last year, and she got glasses. Her teacher has now told us that her attitude has completely changed. She is focusing in the classroom, her grades have improved, and she's no longer disruptive in the class. Without this program, the school would have given up hope on her. Her family probably would have given up hope on her, and she would have lost the chance to bring the next generation of her family out of poverty for lack of a pair of glasses. It's kind of awesome to feel that we're about to turn 100 years old as an organization. And while I'm proud of the incredible strides we've made, what I live with every day is how much more there is to do. We really look forward to continuing our work, helping to empower more women and more children to live healthier and more productive lives and to eventually break the cycles of poverty their families have been trapped in. We look forward to being part of a world where no one has to suffer from blindness that could have been prevented or could have been treated. We look forward to building a world in which far fewer people suffer the ravages of malnutrition. We look forward to a world where, in partnership with others, including my new Kravis Prize family, we restore hope and opportunity to so many people. So I'll close with another quote from Helen Keller, which is in your programs tonight. And I mean it from my heart. Alone we can do so little. Together with our new Kravis Prize family, we can do so very much. So thank you so incredibly much for this honor. And if you want to look at vitamin A, I've got some. Thank you very, very much.
Wow, that's all I can say. What an impact. And one of the things that's very important, as Marie-Josée said, is that whomever has won the Kravis Prize has had an impact. Those 560 million people that have been impacted is just the tip of the iceberg. First, I want to thank my wife, Marie-Josée, who tirelessly and enthusiastically has worked extremely hard at making sure the Kravis Prize was a success. I'll never forget when I came up with this idea to have the Kravis Prize, and she wasn't so sure it made sense, but as we talked further about it, about halfway through dinner, she says, "Okay, you want to do it? I'll do it if I can become chairman." I said, "Great, that's it." So be careful what you stand for. I also want to thank Priya and Hiram, because one of the things when we first met last year, when we were out here for the Kravis Prize, and Marie-Josée and I met with both of them, I wanted to hear their understanding, and I would hope commitment at that time, to really supporting KLI and the Kravis Prize. And we absolutely got that endorsement. And then we met again this afternoon. We spent about an hour together, and we had a great discussion about leadership. And then Hiram and I went over to the KLI board meeting and again had further discussions at the board meeting about leadership and can you teach leadership or not? What kind of metrics do you have to have? And of course, Jay, you got work to do now to do the proper metrics. But so thank you for getting behind the effort of the Kravis Prize, both of you, and thank you very much for the effort and support that you give KLI. Now, what I actually want to say to the students that are in this room and to the students that aren't here, because this is, I think, something very important. Number one, those of you that have been fortunate enough to have attended several of these dinners, you're some of the luckiest students in the world. Why? Because you're exposed to something that so few people your age are exposed to, and that is this great work that's being done in the not-for-profit world, literally globally. So I just want to tell you a story. One day I came home and this was before Marie-José, and my family asked me, they said, "Why are you so excited? It's a Saturday." And I said, "I have just decided to get involved and start a drug and substance abuse program," and I was so fired up over doing this. And they said, you're excited about that. Why are you so excited? And I explained why. And I have to tell you that, yes, I bought a lot of companies. Yes, I've made a lot of investments. Some worked and some haven't worked. Yes, KKR has been successful. But some of the most pleasurable times that I've had is spending time and effort in the not-for-profit arena. The ability to help others who haven't had that opportunity to be as fortunate as I had been. And it's not even a question of giving back, because I don't think any of us necessarily take from society, but it's really helping those people who are less fortunate and don't have that support system, don't have that opportunity to get ahead in the world or to have the prevention of blindness, etc. So I want to encourage all of you students to, whatever you do, give of yourself, get involved in not-for-profit organization, an organization that you care about. You don't have to give a lot of money, it doesn't matter. Give something that's going to be a sacrifice for you, and give of yourself, give the time, and I can guarantee you one thing. You'll remember what I'm saying tonight, and you'll look back and you'll say, you know, this has been some of the most rewarding times that I've ever spent in helping those less fortunate. So you've seen now this incredible list of recipients, of which there are 10, starting with Roy Prosterman, and I wasn't even sure when I called him to say he had won this that he would say yes or no, because I didn't think he knew who Henry Kravis was or Marie-José Kravis, but he was a trusting fellow, I'll tell you, when I got a hold of him. And you know, he said, yeah, I'll take it, sure, why not? Now, you know, I could have been one of those guys, you know, fraudulently selling them insurance or something. But Roy, thank you for accepting it, because you really kicked us off, you know, in 2006. So. And I will tell you that when Marie-José and I started this, the last thing we thought about at the time was that a network would be put together. And this is the proof tonight of this incredible network. And I hope that the network will continue to go for many years. So thank you all for sharing tonight. I hope you found it as moving as I did. Kathy, you're an incredible woman, and you've got an incredible organization. Congratulations again. Thank you.